In the case of allergies, the immune system of the affected person mistakenly initiates its defense against common substances that do not trigger any reaction in others. Allergies can cause anything from mild symptoms to chronic illness, and even life-threatening conditions. Let's learn more about allergies. Although the exact causes of the development of the disease are not yet known, it is clear that, in addition to genetic background, the state of the immune system and various environmental factors may play a role. These may include excessive hygiene, improper lifestyle, poor air quality, or even climate change. We know roughly 20,000 allergy-causing substances, such as allergens. Some of these affect many people, and some that cause symptoms in only a few people worldwide. The disease is affecting more and more people. In the last 2 decades alone, the number of children with allergies has increased by 50%. Research has found that introducing allergens to babies' immune systems early enough can reduce the likelihood of allergic reactions later on. Allergens mainly cause inflammation where they enter the body. This is usually the nose, mouth, or eyes, but they can also trigger a reaction when they come into contact with the skin. Unfortunately, if a substance has triggered an allergic process in the body at first encounter, due to our immune system's excellent memory, this can happen again later. Our immune cells can distinguish between a myriad of allergens, so someone who is allergic to peanuts is not necessarily allergic to wasp venom. However, there are some substances that are chemically very similar. In this case, a cross-allergy may occur. So, for example, someone who is allergic to ragweed pollen may also have a reaction to watermelon or cantaloupe. In this case, the chemical similarity causes the body to identify the otherwise harmless substance as a known allergen and attack it. In most cases, symptoms appear just minutes after the immune system encounters the allergen. This is called an immediate allergic reaction. This is when some of our immune cells identify the allergen as an invader and release large amounts of histamine and other messengers. Histamine is responsible for many allergy symptoms and is also involved in the body's inflammatory processes. In addition to insect sting allergies, the long-known and less dangerous hay fever is also a type of this disease. It is seasonally triggered by pollen particles from flowering plants, trees, and grasses, while year-round allergic rhinitis is often caused by microscopic particles of feces of dust mites floating in the air. It can also be caused by mold spores, certain proteins produced in the body of pets that dander on their fur, or even by smoke and various fragrances. Airborne allergens can cause inflammation by sticking to mucous membranes. Such symptoms, unlike the viral cold, do not go away in a week or two. Allergens that reach the lungs can cause sudden breathing difficulties, coughing, wheezing, and in severe cases, daily asthma attacks. So it is worth seeking medical advice if you notice symptoms. Most food allergens also cause an immediate allergic reaction, most commonly milk protein, eggs, peanuts, soya, nuts, wheat, some raw fruits, and fish. Eating these is usually only associated with gastrointestinal symptoms. But in rare cases, even a single bite can be enough to cause a life-threatening reaction. The most fatal allergic reactions worldwide are caused by peanuts. In anaphylaxis, the reaction is generally body-wide, occurs very quickly, and can be severe and even life-threatening. In such cases, too many histamine and other chemical messenger compounds are suddenly released from the immune cells, which are transported throughout the body by the bloodstream. Due to their effect, the immune system attacks certain parts of the body, sometimes even the whole body. The reaction is almost instantaneous, possibly within minutes and less often within hours. During anaphylaxis, symptoms usually extend to 2 or even 3 organ systems. Skin symptoms are very common, and the lungs and respiratory tract, stomach and intestines, heart and blood vessels, and the central nervous system are also typically affected. It is often associated with loss of consciousness, and in its most severe form, leads to a shock reaction and death. Therefore, in the case of anaphylaxis, adrenaline should be injected into the body as soon as possible. And then hospital observation is also necessary. Also very common is the so-called late reaction type, where symptoms only appear within 1 to 3 days after exposure to the allergen. They are mostly triggered by skin contact, and their most characteristic symptom also appears on the skin. This is dermatitis, commonly known as eczema. Late reactions are most often triggered by latex, certain metals, light, or detergents, but can also occur due to certain food or respiratory allergens. In this case, a group of immune cells called lymphocytes and the chemicals they produce play a key role in initiating and maintaining the late inflammatory response. It is common for an allergen to trigger a delayed allergic reaction in the body after the immediate allergic reaction. In addition, there are 2 very rare types of allergies that trigger immune processes different from those described above. Symptoms similar to allergies can also be caused by various intolerances and certain immune diseases. Milk protein allergy is often confused with lactose intolerance. In intolerance, certain substances cannot be broken down by the body, and this causes the symptoms. For example, if the production of an enzyme called lactase, which is needed to digest milk sugar, is reduced or eliminated, lactose intolerance develops. This can be easily treated by eating so-called lactose-free products or taking the enzyme as a medicine. Unfortunately, it is also possible that the immune system itself becomes ill, and the body starts attacking itself. For example, gluten, a protein found in wheat flour, can trigger such abnormal autoimmune processes. This is celiac gluten sensitivity. Unlike wheat allergy, this disease can be triggered and maintained by other gluten-containing cereals. As allergy-like symptoms can be caused by a variety of diseases, it is important to make an early diagnosis as accurately as possible to choose the right treatment. Allergy tests can be divided into 2 groups, antibody-based and immune cell-based. The choice of the right type of test depends on the nature of the allergy and the possible allergen itself, so it is always worthwhile to have a specialist choose the tests and evaluate the results. It is good to know that a positive test result does not mean that you have an allergy if you have no symptoms. Although allergies are not yet curable as far as we know, they can be controlled with treatment. The most important thing is to avoid contact with the allergen as much as possible. We should report any allergic reaction to a drug to our healthcare professionals, and a previous anaphylactic reaction may also be relevant. Depending on the type, allergic symptoms are either treated with antihistamines or drugs that inhibit the release of histamine, or with topical, possibly severe or general anti-inflammatory steroids. For certain types of allergy, good results can be achieved with immunotherapy. In this case, a purified extract of the allergen is administered to the body in increasing doses, little by little, under hospital conditions. The therapy takes several years, but fortunately, there are immunotherapeutic agents that can be used at home for some allergens. If a patient is at risk of an anaphylactic reaction, an injection of epinephrine should also be at hand. If symptoms are present, ask for help of a specialist who will help you choose the tests, interpret the results, find out what processes are causing the symptoms, and, once diagnosed, draw up the most suitable treatment plan.
Subscribe to our channel. Don't miss out on any new episodes.